हेलो अस्सलाम वालेकुम, वेलकम टू अनदर एपिसोड ऑफ द पाकिस्तान एक्सपीरियंस। और आज के एपिसोड बहुत स्पेशल है, कई महीने लग गए टू पुट इट टुगेदर। इन इन दोनों अजीम लोगों के स्केड्यूल मैच करना और इनको यहाँ बुलाना एक ऑनर भी है, एक एजाज भी है। शर्मीन खान, थेरेपिस्ट, क्लिनिकल साइकोलॉजिस्ट, ऑल राउंड गुड पर्सन। आमना सलमान, PhD, Dr. Amna Salman, now has a doctorate in psychology, all round bad person because she's only achieved things in life by abandoning my friendship. So hi Amna Salman, how are you?
Hi guys, I'm good.
Hi Sharmeen, how are you?
Hi. Can we start by congratulating Amna because she's now a doctor person and she's really mahan and cool.
Thank you.
यहीं से शुरू करते हैं कि
I
क्या
don't know if that's the case.
क्या पढ़ा है आमना सलमान आपने? बेटा बेटा आपने क्या पढ़ा है बताएं। What's your thesis on?
बहुत ज़्यादा psychology पढ़ लिया. I have a doctorate in forensic psychology. So I'm a forensic psychologist. I work with people who commit violent offenses. And my doctorate thesis was about honor killing and honor-based violence. So
Wow.
yeah, so I've done a lot of research in violence against women and how it is perceived in different cultures and how it is addressed in different areas of the world.
Since if people thought I was being more chirpy than usual at the start, आज हमने यही सब discuss करना है. So the point of putting all of this together, I think, is the certain questions have been raised about ethical boundaries of therapy. क्या होता है, किस तरह होता है. So let's just maybe start there because I think Sharmeen had a good idea of putting this panel together. What are these ethical considerations in therapy that people don't think about and should think about here?
I think that from what I've been trained, the main things that you have to consider when you're doing therapy, ethics. Her profession may you have to have good ethics. Any profession in which you're working with other people, you need to have ethics. And I think that the main thing for us is respect. As psychologists, you have to have respect for the dignity of every person that you are working with. The 4 principles that we use are respect, competence, integrity, and confidentiality. So you have to be able to have respect for every person that you work with. You have to be able to be competent in the work that you are doing. So you have to be able to say that, I don't know what's going on. I don't know how to work with this person. I need to get the expertise of someone else. And most importantly, you have to have integrity. You can't abuse your position of power. You can't abuse your knowledge. You can't abuse your position to take advantage of any other people, to take advantage of the people that you are working with, especially if they're vulnerable people, because normally we are working with people who are very vulnerable emotionally, psychologically, and also financially. In many ways, they're vulnerable, and you need to be really careful to be able to say that I am, doing my best to get the best outcome for this person, and I'm not doing it for myself or for any other reason.
I mean, don't wait for me. Ideally, I sit back in the two.
I'm waiting for Sharmeen.
I think that was very well summarized. And from a Pakistani perspective, what I can give is how those 4 principles are not always met. So, for example, when it comes to respect, often because ये भी होता है कि उर्दू इंग्लिश मिक्स कर सकते हैं ना. हाँ. अक्सर जब आप कभी सरकारी जगहों पे जाते हैं तो एक वो होता है क्या है ये तो अनपढ़ है, या or the way people come into psychiatric or psychological treatment is by going through many different departments in a government hospital, and then when nobody else can treat them, then they end up in that place. So ये भी cases होते हैं कि कोई कहता है ये psycho का patient है, or things like that. So that disrespect starts already from the point जहाँ पर्ची बना रहे होते हैं. So making sure that people understand from the receptionist all the way up to whoever is involved in the treatment of someone who is coming for psychological support, कि सिर्फ क्योंकि वो psychologist के पास जा रहे हैं वो psycho के patient नहीं है, is very important. So that comes in respect, and boundaries are very important. Like Amna said, कि if someone is beyond your understanding, or your scope of knowledge then or experience, then saying मैं ये case नहीं handle कर सकते. Over the time that I have been practicing, I've had a couple of very complicated cases, which जो मेरे बस की बात नहीं थी, सीधी सी बात है, like नहीं होता अक्सर because बहुत rare cases होते हैं. But then like making that clear to the client that this is something I cannot do, or having a panel of people working together is very important. So a lot of people maybe don't have the necessary qualifications to take on a lot of clinical cases that come through, which शायद उनको पता भी नहीं हो कि वो practice करें, कि उनको ethical boundaries कभी कभार सिखाए नहीं जाते.
थेरेपी या साइकोलॉजिस्ट या साइकियाट्रिस्ट, तो मुझे पता चला है गवर्नमेंट अस्पतालों में, एंड ये जो लोग स्टेम वाले होते हैं ना, हु थिंक हम तो साइंस करते हैं सिर्फ. आई रिसेंटली फाउंड आउट दैट पीपल आर ऑलमोस्ट ट्रेन्ड इन गवर्नमेंट हॉस्पिटल्स कि कुछ पेशेंट्स आपके अटेंशन सीकर्स होते हैं, ये बस अटेंशन लेने के लिए आते हैं. एंड यूजुअली वुमेन आर सीन एज दैट कि यार घर पे ये बोर हो रही होगी तो इसलिए हॉस्पिटल आ गई. सो दे टॉट टू ट्रीट देम लाइक दैट कि अच्छा इनको आप जिस तरह वन ऑफ the doctors was telling me कि हमें बोला था कि अगर कोई आए ना उसको कैथेटर लगा दो ताकि वो आइंदा कभी ना आए. And I was like ये what, so if this is how they're treating patients with physical pain which may be more tangible, तो कोई mental health आ रहा है तो I can only imagine वो क्या कर रहे होंगे.
I mean, I understand that because there are certain psychological disorders like, someone who's a hypochondriac or something that can come into those categories. मगर साथ साथ pain disorder भी होता है और भी चीजें होती हैं. And पाकिस्तान में placebo effect बहुत like it works really well. So over the years, the doctors that I have spoken to, and my mother is a doctor, so I've grown up in a household of doctors. Like 3 doctors होते थे मेरे घर में बचपन में. पानी के इंजेक्शन की जो कैपेसिटी होती है ना मिराक्युलस क्योर्स लाने के लिए, it is beyond even maybe, I'm sorry, chemotherapy. So the thing is that for a lot of people, and placebo effect is a real thing. You even can get like आपको काफी psychiatric wards पाकिस्तान के अंदर actually have placebo medication which they give to people because उनको लगता है ये नफ्सियाती इलाज क्या होता है, जब तक गोली नहीं मिलेगी हम ठीक नहीं होंगे. मगर yes, respect with that is important.
And I think the danger of that is applying it to too many things. कि होता है कि हर किसी भी psychological problem के लिए हम placebo try करते हैं because everything is just in your head. And I think that you need to be careful and be like, and I think that's why one of the things that you said earlier is really important, to work as part of a panel or work as part of a team. कोई अकेले, you should never be doing therapy just by yourself and nobody knows what you're doing with that patient. There should always be someone who you're talking to about your therapy, and then they're talking to someone else. There's always someone supervising everyone. It should never be कि बस एक अकेला बंदा किसी के साथ काम कर रहा है and they're just gonna see how it goes. क्या नाम, अमेंडा नॉक्स का केस किसी ने फॉलो किया था? फॉक्सी नॉक्सी, Amna, you must have. The Sun and UK में तो वो हर जगह. This student who went to Italy and then उसकी roommate was found dead and then the Sun went crazy कि फॉक्सी नॉक्सी है, इसने मारा है. No, I don't remember this.
Yeah, she was on, I was listening to her. She now has a podcast and she was talking about the basic empathy and basic humanity in all of us. And she was like, मेरी जब मैं जेल गई थी, and she was falsely accused, falsely convicted also of the crime. She was like, मेरी एक दोस्त थी, उसने अपने she killed her child, and in our society you'd think it's probably the worst thing a person can do because the whole idea of motherhood is tied to the child. And it was also almost something that at least in our society you wouldn't think of it as an excuse. She was like, uski bas ho gayi thi uski, and she was like, yeah, but when you're in prison with that person, you see the humanity in that person. So I'm sure it's difficult to do that. And the reason I'm bringing this up is, Amna, I know you've been in a dangerous situation, but you've even if when you're talking about those situations, you really humanize the other person. So how difficult is that to do in those situations?
I think when you initially start, it's like you read a lot of stuff about people and you read that is bande ne ye kiya, isne wo kiya, and you read like a lot of horrible things, what their risks are and what their offenses are and stuff. But then after a while, after you've been working with people, you realize that nobody is defined by that one incident or whatever incident occurred. Like there's a lot of other things that are a lot of things about them. There's a lot of other personality traits that they have. There's a lot of other interesting things about them. And you can't work with someone if you just focus on all of the negative things, if you just focus on the bad thing that you've done, if you just focus on the crimes that they have committed, it's impossible to try and move forward, to try and work with them, because you have to find those positive things about them. You have to find the things that are going to help them move forward with their life. So I think mushkil hota hai, especially when you read like some of the offenses. Like for me, I get very triggered by offenses that are violence against women. And I like, whenever I read such an offense, I'm like, oh, now I have to go and meet this person. I don't know how I'm going to feel about it. And I don't know how they're going to act. And I always have like a little bit of a anxiety कि पता नहीं क्या हो जाएगा. But then when you actually go to work with people, you have to kind of have a really open mind and you have to try and find other things about them that you can work with.
I also feel कि एक switch on off हो जाता है कि जब आप किसी के सामने होते हैं तो आपकी personal biases सारी side पे कहीं हो जाती हैं, and it becomes very easy to just focus on that one person from a very neutral perspective without actually putting them in a category.
Yeah. And I think it helps to also you have to have, I've noticed that psychologists, forensic psychologists, clinical psychologists have a really twisted sense of humor, because you have to get that out, like when you're then in a group of people who understand the kind of people that you are working with, you need to be able to get out those latent opinions.
Don't blame your profession on your twisted sense of humor. It existed way before your profession.
Cause and effect, right?
That's why I'm so well suited.
Sharmeen, is it almost like a surgeon कि अगर उसके सामने बॉडी पड़ी हुई है तो वो हार्ट और उसको किडनी नजर आ रहा है, it's not concerned about कि इसने क्या किया है या कब किया है. Is it almost that deep personal? I mean, it's
for the most part, yes. For the most part, I mean, let's say 80% of the time, yes, it is like that. Magar then 20% of the time, jab surgeon ke table pe someone passes away, the surgeon is impacted, right? He lost a life. So the same way, there's this concept of transference that over time, when you do, even in a very clinical environment, spend time with someone, you do tend to, get feels for them. Some form of emotion can be good or bad. Pardon?
You become attached to the people that you are working with, whether it's good or bad. Even if they're driving you crazy, even if you think they're horrible, you become attached to them. And you also, because you feel like it's your responsibility as a therapist, psychologist, doctor, whatever, it's your responsibility to stand up for that person and to help that person. And so sometimes it's easier to kind of put those judgments aside and be like, no, but this is what I have to do. I know he's done something really bad or whatever, but I need to try and help this person. So that helps you to kind of put it aside.
अजीब सा एक सवाल पूछता हूँ, क्यों क्या जरूरत है सबको हेल्प करने की? I mean, aren't some people beyond help?
I don't believe so. I don't know if Sharmeen believes so. I don't
think I've met anyone beyond help.
Hi, Sharmeen. My name is
Shahzad, you're fine. You're helping yourself every day and so many other people. क्या जरूरत है ये सारे podcast करने की?
Exactly. ये therapy तो हो रही है, like constant therapy.
So I sort of the reason I brought this question up as well कि the string of violence against women के जो खबर पाकिस्तान में चल रही थी, and then we thought of having this podcast. I think when you listen to the graphic details of some, and we did a podcast after that, and Ekta was on, and she was talking about कि नहीं भाई hang करें, and I'm very against capital punishment. I'm against मतलब public hangings. So I just find कि मुहज़्ज़ब civilized societies में ऐसी चीजें नहीं होनी चाहिए. But then I also get the anger. I get the anger that there's a little femicide happening and people are just like, we just want to see somebody hang. A, how do you respond to that? And B, I don't know. What's your response to that idea?
So what I'm going to say right now is going to be maybe a little controversial. And Amna, please, like, you know, clean it up. Okay. So the thing is, as a society, right, we're at a stage where we're going through our feminist movement now, today. And because of that, I think over the last year or so, the good thing that has happened is कि जो चीजें जो media में पहले बात नहीं होती थी. If you go back 10 years and Mukhtara Mai went and stood up for herself, you know, even women, men, सब कहता हो से शर्म नहीं आती जाके सबको बता रही उसका gang rape हुआ. And Mukhtara Mai over the last 10 years has done 10, 15, jitne bhi years. She's done so much for Pakistan. She's done so much for women. She has set up NGOs and schools for girls and so much stuff, but nobody talks about that. Because she came from a place of shame, right? If you speak to the modern feminist, she does not know who Mukhtara Mai is. And I've spoken to a few people. So the thing is कि सब कुछ कर कर अब जो है ना ये चीजें media attention ले रही हैं. Media attention ले रही हैं, which is beautiful. So it's not like ये चीजें ज़्यादा हो रही हैं. They're just coming into the limelight more. So people are more aware of stuff that is happening anyway on a daily basis. So that's one thing. The second thing is I think on a communal level, on a social level, we're going through our stages of grieving. So right now, everyone is angry. And I see that as a good thing because it's progress, but it's also leading us towards something. It's not like anger for the sake of anger. It's one of the phases of maybe coming into realization of where we stand as women. So शायद आज का stance हो कि सारे मर्द बुरे हैं. I don't believe all men are bad either. You know, I mean, that's, but it's just a phase, I feel.
I don't think that is aaj ka stance, and थोड़ी generalization है by saying the modern feminist.
Because my social context में मैं एक like larger scope ले रही थी जो आजकल जो गुस्सा बाहर आ रहा है and stuff like that, which is why I said it might be a little controversial because I'm going to speak about like a very generalized social stance because it is the zamana that our media or we are going through as a people.
इसमें सिर्फ बहुत अच्छा anecdote ये है कि when Mukhtara Mai came forward, परवेज मुशर्रफ said कि ये औरतें asylum लेने के लिए अपना gang rape करवाती हैं और आज परवेज मुशर्रफ asylum लेकर कोर्ट से भागकर बाहर है and Mukhtara Mai is still in Pakistan. Amna, thoughts?
Yeah. No, I think I agree with that completely. I think that even in Western societies, when the feminist movement began, it began with a lot of anger and it began with a lot of like polarizing between men and women and fighting between men and women, because I think that's the starting point. When they see the problem at face value, they're initially going to say that this is a gender problem, this is a problem between men and women, but actually it is an equality problem which takes much longer to address. So like Sharmeen is saying that you first need to bring these issues into the conversation. You need to first bring them to people's attention so that the public can start to think about it from different perspectives. Because right now, I think most people are still in that phase where they think that this is a gender issue and either men are going to win or women are going to win. But it's going to take a lot of conversations and a lot of reflections for people to realize the bigger factors that are playing into this issue. So social issues, political issues, economic issues, education issues, all of these things are playing into, you know, violence in societies, not just violence against women, but violence in societies in general. And I think that it's very easy to focus. And that's why you have people that get so angry that, you know, want capital punishment, because it's like, and in this phase, you don't see any solution. You don't see like, kya kar sakte hain iske bare mein? All you can do is go after the people who are committing the crimes. But actually doing that is not addressing the problem. Just going after the one perpetrator who has come to the attention of the media, whose case has become public, is not addressing a problem which is happening everywhere all the time. So I think, yeah.
Especially legal field में जो लोग काम करते हैं, you would know कि पाकिस्तान में कितनी wrongful convictions हैं. Literally पैसे देकर लोग जेल गए हुए होते हैं कि यार ठीक है आप मेरी फैमिली को पैसे दे दीजिएगा, मैं कबूल कर लेता हूँ कि ये crime. In a country like that with an abysmal wrongful conviction rate, if you want capital punishment, plus I think it's sort of also an appeasement, right? कि अगर हम rape culture की बात करें, कितनी चीजें हैं जो promote करती हैं, enable करती हैं, but by saying hang the rapist, it's sort of this idea कि ये हमारी मुहज़्ज़ब माशरे में are such a great society we live in, एक ये monster आ गया था, इस monster को अगर आप hang कर देंगे तो सब कुछ ठीक हो जाएगा, and then we can go back to living in a brilliant society that we have. I just want your ideas on where this idea comes from, and we are really susceptible to mob violence in Pakistan. Is there a reason that हम इतने susceptible हैं?
I think there are different types of societies. So when I was doing my research, I was studying the difference between collectivistic societies and individualistic societies. So most societies in Asia and the Middle East and Africa are quite collectivistic societies, which means that they see themselves all as part of a group together, even if they don't, even if they're not related to each other, they don't know each other, everyone sees themselves as part of one collective group. And so those attributes of things like shame and respect and honor and things like that, they become collective attributes. So we start thinking कि अगर उसको किसी ने disrespect किया, they've disrespected all of us, and we all need to respond to it because we all need to protect the image of our society. And on the other hand, in Western societies, they have the same problem of violence against women, but it is from an individualistic perspective, because whereas in collectivistic societies, women are abused, or violence against women is perpetrated by family members, by their husband, by their fathers and brothers. In individualistic societies, it's more likely to be their husbands or their boyfriends or their partners, because they have this notion that honor or shame or whatever, respect, is an individual attribute that all of us hold in ourselves. So then it becomes just me and my immediate family, or the people who are very close to me, who are affected by my behavior. So I think that's why it's very easy in collectivistic societies for mob violence to occur, because people see it as a collective insult, that it's a collective thing that has happened to all of us. And so we all need to fix it in a way, restore it.
Sharmeen, you have any thoughts?
Yeah, so I wanted to add a couple of things. One was that just like पिछले उससे आगे करते हुए कि we're speaking about mob culture, we're speaking about violence against women because it's it's trending right now, right? Statistically, boys are actually abused more than girls are. Statistically, like Amna said, it is the close family members who do it more than out external mobs do. Those things have not made it to the media yet, and I just like to leave that here as food for thought. And the second thing, mob culture, like Amna said, it has a positive influence कि सब अपनी बहनों के लिए खड़े हो जाते हैं, मगर then it has a negative influence as well, which is the anonymity in a crowd, which is more, I think it's more universal. जो कहते हैं ना कि matches पे आप जाते हैं, सब शोर मचाना शुरू करते हैं, या party के अंदर सब loud हो जाते हैं, जो normally घर पे कभी नहीं नाचेगा, वो मेहंदियों पे सबसे आगे भंगड़े डाल रहा होता है. The same way in a mob culture, अगर आपको पता है कि 6 लोग जाकर एक लड़की को छेड़ रहे हैं, चलो boys scene है, कोई पता भी नहीं चलेगा किसने किया, तो 600 लोग चले जाते हैं. Because anonymity that a crowd gives you allows you to maybe act out your most primitive animalistic urges, which you would not act upon otherwise, maybe.
Yeah, it's that diffusion of responsibility. And it's also the notion that everyone is going to accept my behavior because everyone is engaging in the same behavior. So it really empowers you, because you don't feel like you're doing anything wrong, even if you know that you're doing something illegal, even if you know that you're doing something, whatever, everyone else is engaging in it as well. So then it doesn't feel like you're doing anything wrong. It feels like it's accepted.
Yeah.
Almost like you two are talking about social media and cancel culture. It's literally how all of this works. So when things like the Minare-Pakistan incident happened, people are like, 500 लोग कैसे कर सकते हैं? 500 लोग थे इसीलिए तो कर सकते हैं. None of them feel an individual responsibility. All of them will go home and sleep at night, or thing like Mashal Khan happens. People like, यार मैंने तो एक थप्पड़ मारा था, मैंने तो एक पत्थर मारा था. But all of that adds up. Literally अगर सड़क पे कोई बोल दे ये बंदा चोर है, तो लोग दूर दूर से आ जाते हैं कि यार एक चमार, एक तो मैं भी एक तो मैं भी मार के जाऊं ना उसको. So yeah, I think incidents like that show us के जो mob जब बन जाता है, people don't feel an individual responsibility.
And it's also important to see that the mob might not necessarily always be a bad thing, like Amna said, right? यहाँ एक्सीडेंट होने से पहले ही 400 लोगों की हुजूम जाकर खड़ी हो जाती है. Be that entertainment purpose, be that helping purpose, a lot of those people are helpful. They save a lot of lives, and that is a part of our culture, right? तो वो mob अगर 400 लोगों का गया था, in retrospect, it might be difficult to make that discernment, but maybe some of those people actually went to help the girl. But in that mob itself, it could, come off as something else. Like, वो खुद jostle हो रहे थे, वो खुद, शायद एक बंदे ने लड़की का कंधा पकड़ा उसे निकालने के लिए कपड़े फट गए. I'm sorry, like कुछ भी हो सकता है. So keeping that in mind is also important, that mobs are not always necessarily just negative or positive.
And I think that comes back to what I was saying before, that we always make the mistake of focusing on the person or the people who have committed the crime, and we want to look at them and analyze them and figure out why did they do this thing on that day, when actually it's a much wider problem that the mob felt that this was, an appropriate behavior to engage in. It's not the mob that is the problem, it's the behavior that is the problem, that everyone was accepting, essentially.
That's what I'm talking about, the wider culture, right? So for instance, she was a TikToker. अब हमने हमारी सोसाइटी में एक आइडिया बना दिया है कि टिकटॉकर बेहया. आज एक न्यूज आई है that the man threw acid on his wife because she made a TikTok. जब आपने एक सोसाइटी में आइडिया बना दिया है कि जो इंसान टिकटॉक यूज करता है वो तो बेहया है, वो तो सेक्सुअल है, वो तो इनवाइट कर रहा है. If that's the idea that you've created, you perpetrated, the state itself is involved in saying कि जी ये TikTok है और फहाशी फैला रहे हैं और बैन कर रहे हैं. So then you're telling people, right, that anybody who uses a TikToker is a certain kind of person. And in certain people's minds, that person becomes then kosher to do whatever to.
And you kind of condoned people's opinions towards them and kind of said that it's okay. And that's part of the problem, is when you're able to kind of something called moral neutralization of violence, when you're able to commit violence and then go, actually, I did it for a good reason and everyone will agree with me. Even though it's illegal, I accept that it's illegal, I accept that it's bad and violence is bad, but I did it for a good reason and everyone will agree with me. And that's what the problem is that needs to be addressed, is that when there are issues in society that are being portrayed in a way that encourage violence and empower people to commit violence.
That's pretty much honor killing also, right? Because मैं Girl in the River देख रहा था, उसमें जो बाप है वो कहता है मैं तो अपनी बेटी से बहुत प्यार करता हूँ, लेकिन मैं गली में कैसे चलता अगर मैं इसको मारता नहीं.
It's also really interesting how moral neutralization of violence, that's what you said, right, Amna? How it's as in there's a class system that's attached to it. So the recent like crimes that have made it into the media, the social hierarchy that they came from, especially if you look at the Noor Muqaddam case or stuff, people actually assume that these people were above the law. कि ऐसे सर्कल्स में तो ऐसा होता है, वो जाते हैं लड़का लड़की एक दूसरे के घर जाते हैं, ये सारी चीजें हो रही होती हैं, like एक certain mindset भी बना हुआ है कि यहाँ it's allowed, यहाँ it's not allowed. So that also becomes a part of our cultural dialogue in Pakistan, that अगर यहाँ ऐसी चीज हो गई तो फिर वो, that's another reason why people started feeling unsafe. कि अगर इन लोगों के साथ ही हो सकता है तो फिर किसी के साथ भी हो सकता है.
And that's a really interesting point, because one of the things that affects how people kind of view violence and view these kinds of like honor killing and moralistic forms of violence is that honor and reputation and image are kind of used as social capital in areas where people don't have as much social capital. So it's interesting to think that when you look at more affluent areas and you think that they have a lot of social capital, they have money, they have status, they have a good reputation and everything, it's more difficult. It's kind of easier to go like, हाँ इनकी society में होता है, and it's not that big a deal, when they mix and when they do stuff like that, when वहाँ पे लड़का लड़कियां मिल रही हैं, drinking हो रही है, whatever, it's fine because they have a lot of social capital to back it up. But when people are from lower socioeconomic status, for them, their image is everything. They don't have anything else. And so it kind of plays into that notion, okay, your honor or your reputation is worth more than the life of one person in that family.
It's like that guy on the street जो किसी को ऑडी में देखता है, he's like हराम कमाता होगा. He can go to sleep at night thinking like ठीक है इसके पास ऑडी है, but I'm a better person than this person because मैं हराम नहीं कमाता.
Yeah,
and
so
even
that's all you have. Yeah.
And even I think class does play a factor. You can absolutely never invalidate anybody's personal experience. Their personal experience is their personal experience, and something happened to somebody that affected them, that is valid. But in terms of harassment, our general conversation is the guy on the street, whereas when we see a lot of these cases of assault, they usually happen in close quarters. It's always about power. It's about somebody who has power, who has influence. And Joe, Sharmeen was talking about, in these circles, it's prevalent. It's prevalent in these circles in high society, but you don't necessarily think of that guy coming out of the Audi when you think of harasser. You think of the guy standing on the street scratching his balls.
And it's part of the way that society, that public perception is, the way that society is, the way that we are brought up, the way that the media portrays things, that kind of you immediately have these preconceived notions about certain groups of society that you have to kind of check yourself and be like, actually, is that something true, or is that something that I'm just conditioned to believe about someone? Because actually, in most cases of violence, not just towards women, but towards anyone, violence is not committed by strangers. Violence is usually committed by people that you know, people in your family, your friends. And it's not, out of the blue that, you were walking down the street and suddenly someone jumped on you. It happens, but it's not the most common form of violence that occurs.
So is it true the इंसान थे पेंडे ने, हम तो जो classically ट्राइब्स में थे कि यार दूसरे ट्राइब का हमने बंदा देखा, इसकी शक्ल ऐसी है, ये करता है, और वो बस हमारे दिमाग में कंप्यूट हो गया है. So unless we consciously, I don't know if anybody knows Usman Liaquat, is a friend of mine. I was talking to him and he said कि ये जो लोग बोलते हैं ना, I don't see color, it's bullshit. हम सारे naturally, consciously racist, sexist, सब कुछ हैं, because our brains are designed to make categories. I see this person, woman, bad driver, tuck, all women bad drivers. So unless we consciously unthink that and make an effort to consciously not be sexist, consciously not be racist, our default positions are these. Okay, we see a person from a tribe who looks a certain way and we just assume कि हाँ ये सारे ऐसे हैं.
Or like that. I think that's how our brains are designed in a specific way. Our brains are always taking shortcuts. Our brains are designed for survival, to make quick decisions. So if you see somebody doing something dangerous, then your brain will automatically make a note that, oh, next time I see this person, I could be at risk. So the next time you see that kind of person, your brain immediately goes into threat mode and goes into, oh, I need to be careful, because that's just how your brain is designed. Your brain is designed for survival, to make quick decisions to keep you safe. But we have an extra part. So human brain, we have an extra part of our brain, which is there for higher brain functions like decision making and planning, things that only humans are doing currently. And we need to be able to develop those parts of our consciousness, and we need to be able to use that part of our brain and go like, actually, I know that this is not a threatening situation right now. So it's like if you see, it's like if you see a wild animal in the street, you immediately will be like, okay, this is a risky situation, I need to run away. But at the same time, you see a wild animal in a zoo, the first thought that your brain is going to have is, oh, there's a wild animal, you need to run away. But then you're going to be like, no, this is not the same. This is not as risky a situation. I know what's going on right now. So it's that conscious reflection of what's going on and being able to make a conscious decision without always relying on on your basic instinct.
Sharmeen, I have a very specific question for you. So, मैं pandemic के perspective से ये सुन रहा था कि a lot of us are so stressed because what Amna's talking about कि threat perceptors जो हैं हमारे, because of the pandemic, they're constantly on. We're constantly in a state of stress. Literally shaking a hand makes you think, shit. Did I just get COVID? I hugged a person on Saturday and I was like, oh shit. Like वो आपका survival mode constantly on होता है. With violence against women in particular, our news also benefits from sensationalizing, from this breaking news model के stress or threat perceptors आपके hit करता रहे. And I like my only advice to people and friends close to me is just disconnect for a bit. And then they're also like, we can't disconnect from being a woman in Pakistan. This is where we live. What do we do? This is our reality. So what do those people need to do to at least not die from constant stress?
So I'd like to start from where you started, the pandemic, because there will be some men listening to this, hopefully. All 7 billion of us have been through a traumatic incident over the last 2 years. So yeah, all of that stress that we feel is real. We've all been through certain traumas, and acknowledging that and being kind to ourselves for that is very important. The same way, like you said, the sensationalization of the news. I mean, आप news सुनते हैं तो अचानक से like, एक panic attack हो सकता है कि बिल्ली दरख्त में फंसी हुई है. उसके अंदर, there's real violence against women happening. There's real stuff happening. It's in the news every day. On one side, thank you news for picking up on things that are important. But on the other side, especially after those 3 or 4 cases that happened just before Eid, every client I got, man or woman, that is all they could speak about. There was trauma, there was fear, there was stress, there was worry, there was, for the women, it was, how can we ever leave home again? Anyone can be a perpetrator. For the men, it was, how are we ever supposed to speak to women again? If anything we see can be seen as a form of abuse. So, everyone has also been impacted by this. So yes, same rules apply. You have to disconnect from that stimulus. If the stimulus of the news is something that is triggering you, so being constantly in a place where you're like you have access to that trigger is just going to make things worse. So disconnecting from that trigger is important, and reconnecting with your own life. So grounding yourself in your reality. Let's say that one of your friends is someone who is in a happy relationship. So, reminding themselves that I'm in a safe relationship, I'm happy, I have my friends, my people, my family who take care of me, and just reiterating where they are in life instead of absorbing the fear of other women. Because when we feel safer in who we are, we're in a better position to help others. Feeling unsafe because someone else went through something is counterproductive for them and for me. And just one more thing, that is the difference between sympathy and empathy. So sympathizing with someone, crying because someone else is crying is not really going to help them or you, which is why, like once you are more solid in your connection with yourself, you can deal with your emotions better. You can be there and help other people from a space of neutrality instead of anger or grief or fear or any of those emotions.
There's also this really good technique when you're having a panic attack. What is it? The 5 things I can see, 2 things I can touch. Kuch is tarah ka hai? Do you guys know about it?
Grounding exercise. It's called a grounding exercise, which helps you to bring yourself back into the present moment and ground yourself in the present moment and kind of bring your physiological and psychological arousal down a little bit. So you do, I do 3 things, but I work with young people and they don't have attention span, but three things that you can see.
I'm young at heart.
Yeah. 3 things you can see in the room, 3 things you can hear in the room, 3 things you can touch in the room. So it helps you to kind of bring your attention back to the present moment and kind of reflect on what's going on and what's making you.
My attention span is even less. So when I think about 3 things I can touch, I can only think about the one thing I can. You saw it coming. Sorry. Well, at this point, I feel like regular listeners who binge on the Pakistan experience, they really benefit from mental health conversations. Because अगर आप सारी ये podcast सुन रहे हैं तो आपको भी therapy की तो जरूरत है ही.
I think everyone can benefit from therapy. I think everyone should go to therapy in their life.
I agree. I think that there is a misconception that you have to have some kind of psychological problem or mental illness to go to therapy. It's not the case. I think that therapy is just there to, to help you live your life, because we are all stressed all the time. Everything, life sucks. We all need to get through it. And I think that therapy is it's a really good way to get some support, because I think most people don't know how to get that support from within their own friends and family. And there's too many barriers to accessing therapy sometimes.
That's also been made a little worse in Pakistan, where people are questioning their therapists. कुछ लोग जो train हो रहे थे, उन्होंने अपने paper फाड़ दिए and dropped out. Not to name anybody, because हम sue हो सकते हैं, but if there's certain jerks like therapy jerks, कुछ ऐसे लोग हैं जो इस तरह पे, I mean, like कौन से profession में ये होता है? आप imagine करें ना कि आपको heart attack आया है, आप hospital जाएं, वो आपका इलाज करे, बोले आपको हार्ट अटैक आया था, आप हार्ट सर्जन बनना चाहेंगे? That's literally their model. कि कोई आता है कि मुझे मसले हैं, they're like, I think you should be a therapist. ये क्या Ponzi's pyramid scheme है ये?
It makes no sense, because I don't understand what qualifications you have to have, or what experience you need to have in order to become a therapist. And I don't know, Sharmeen will enlighten me. करना क्या होता है पाकिस्तान में? Like,
I think Tobias had more credentials to be a therapist.
Who had more credentials?
Tobias from Arrested Development.
Oh, okay. So सबसे पहले जो हम बात करते हैं, पाकिस्तान में एक और चीज़ ये भी होती है कि हम डॉक्टर के पास तब तक नहीं जाते जब तक हमें एड्स नहीं हो, या कैंसर नहीं हो, या हार्ट प्रॉब्लम नहीं हो, राइट? सो जिस तरह हर 6 महीने बाद हमें फिजिशियन से मिलने जाना होता है, उसी तरह having a regular therapist just to go and talk to is a nice thing. That's one thing said. As far as qualifications go, पाकिस्तान के अंदर qualifications जो आपके सरकारी level पे हैं, वो minimum master's degree है to practice. So to be hired into a government role, you need a postgraduate diploma or a master's degree to practice as a psychologist in a hospital or in the army or whatever. Uske baad, MPhil is higher than just an MA or an MS degree, which is half a PhD. So it allows you to have the title of clinical or psychologist or counseling psychologist if you have done it in those roles. Pakistan के अंदर clinical psychologist ज़्यादा होते हैं. Forensic Psychologist उन्हें शुरू किए थे कराची यूनिवर्सिटी में, वो ख़त्म हो गए. खैर, like psychology बहुत बड़ा वो है, काफ़ी यूनिवर्सिटीज़ से होते हैं. And PhDs बहुत कम है. They normally go into academics because PsyD की degree यहाँ available नहीं है, which is like the more practicing degree. So keeping all of that in mind, there are other ways that you can become counselors. For example, there are certain places where you can go and you can get certifications and a supervised training to be a counselor. A counselor means that if you're trained in one particular kind of therapy, now to become a clinical psychologist, you're trained in at least 20 to 30 kinds of therapy. Right? You're trained in how to diagnose a person with, acha, ye symptoms hain, to inka kya karna hai. Plus, you have a certain ethical obligation to continuously study for the rest of your life, to do something for your continued education. So at least 2 certifications or workshops every year. That's like, right, Amna? Yeah, okay. So, and then हमारे पास ये भी option होती है कि हम international certification साथ साथ कर सकते हैं, क्योंकि we don't have a body over here. So there's a Pakistan Psychological Association, which gives you a lifetime membership, which is important because when someone asks you आपकी license number क्या है, आप वो देते हैं, मगर that's not a government licensing body. It is an association, so it's private. साथ साथ a lot of psychologists that I know जो बाहर से पढ़ के आए हैं, like if Amna ever practiced in Pakistan, she has a British Psychological Society licensing, which would actually work here. So जब आप नौकरियों पे आते हैं, these things matter. Or like I'm an American Psychological Association international affiliate. So these things give you that validation that if someone comes to you and asks for help and they ask for your qualification, you can say अच्छा 6 साल पढ़ाई की भी है मैंने, सही PhD नहीं है मेरा, मगर 6 साल की पढ़ाई है, 12 साल की experience है और ये मेरी certifications हैं. तो उसके बाद आप APA से पूछेंगे आपने इसको क्यों दिया. हाँ, ये जो सर्टिफिकेशंस होती हैं ये वन काइंड ऑफ थेरेपी के अंदर होती हैं. उसके अंदर डायग्नोसिंग ऑब्वियसली आपको नहीं सिखाई जाती क्योंकि आप 1 से 2 साल पढ़ रहे होंगे एंड अंडर सुपरविजन होते हैं. तो दैट इज वेयर द लिमिटेशंस कम इन, दैट Amna discussed initially as well. If someone has a diagnosable condition, you cannot go to a counselor and expect them to take care of it. If someone has a diagnosable condition that is leaning towards psychosis, then a psychologist is not enough anyway, because that person will also need medication. So you will again work as a team. So working in isolation and thinking that, okay, today I will help you, I will cure your psychosis, and tomorrow I will marry you, because, you know, what are ethical boundaries? It's very important to know. It's very important to know where to draw these lines, because it's you using a very powerful position in a not so nice way. I'm out of words now. Thank you very much.
पूरी ऑर्गेनाइजेशन खोलूं और अपने क्लाइंट्स को रिश्ते भी ना भेजूं, ये क्या बात हुई यार? मतलब कुछ तो फायदा हो मेरे उसका. बट चलें, ये जो आपने बातें की रिक्वायरमेंट्स, दे लुक ग्रेट ऑन पेपर. कल को इफ आई बाय अ स्पेस इन कमर्शियल एरिया and I say, Shazad, counselor, pay me 5,000 an hour, what's stopping me? In what world is that illegal in Pakistan?
Nothing is stopping you.
Yeah, that was going to be my question, because I think that was very well explained, all the proper steps that you need to take in order to, you know, do therapy and everything that ethically you need to do therapy. But like you said, if there's no governing body in Pakistan, who's checking? If you did something unethical and one of your, Sharmeen, if you did something unethical, who are your patients going to complain to?
Please tell me, please. I need to know. I have receipts.
मैं सिंगल चल रही हूँ. मैं अभी फिलहाल ना, मैं आप जरा आए ना थेरेपी के लिए खुशबू लगा के.
I have receipts.
Like, yeah, like I don't understand who's supervising, who is making sure that people are not abusing their position.
So right now, effectively speaking, I think it's safe to say no one. So for example, there was this someone I studied with in university who came in for a 1-year master's. Next thing we know, he comes in with a briefcase one day and he handed a card to my dean. And my dean was so pissed off. She's like, इसने जाकर अपनी दुकान खोल दी है, इसको psychology का ABC नहीं आता, और ये लोगों, but you know, no one is stopping him. So what is very important is to do your research, to make sure that as someone who is seeking a service, you know, we can't go in and then say the service was shitty. हम किसी एरे वगैरह मैकेनिक को कभी अपनी गाड़ी तो नहीं देंगे ना, क्योंकि गाड़ी हम कीमती है, हमने इतने लाखों रुपए में गाड़ी खरीदी है, हमारी जान उससे भी ज्यादा कीमती है. तो अगर आप कहीं भी जा रहे हैं कुछ भी कराने के लिए, make sure that, you know, you check in. अच्छा, आपकी qualifications क्या हैं? And you're not offending someone by asking those questions. These are your rights. To know, okay, what are your qualifications? How many years have you practiced? Where have you been? And maybe I am wrong. Maybe someone comes to me and my qualifications are not enough, and that is okay as well. Maybe I need to fix something, and that will also, you know, checks and balances should be everywhere. Imran Khan की हुकूमत है यार, checks and balances.
आज तक किसी पाकिस्तानी ने किसी मैकेनिक के credentials कभी नहीं check किए.
मगर जरूरी है ना.
In what world does this happen? उस दिन मेरी गाड़ी खराब हो गई.
When you go to the hospital, like in Pakistan, you ask the doctor क्या आपकी qualifications.
Yes.
I wouldn't, but now I will. Thank you, Sharmeen.
Yeah, because आपका हक है. And a mechanic के साथ भी, right? आप अपने boys से जाकर पूछोगे, यार मैं फलाने मैकेनिक के पास जाना, बोलेगा नहीं, चोर है, उसने मेरा वो gasket पिछली दफा एमी में ठीक थी, और वो, you know, like those like
उस दिन मेरी गाड़ी बारिश में बीच रोड खराब हो गई थी. I kept calling. I was like, जो आ जाए. फिर उन्होंने पूरी गाड़ी खोली, 3 घंटे में रोड पे था. इवेंचुअली सिर्फ फ्यूज का मसला था, वो जो चौथा मैकेनिक आया है उसने डायग्नोज करके 2 मिनट में ठीक कर दिया, बट टिल देन पूरा डैशबोर्ड खुल चुका था, सारे एक्सपेरिमेंट्स बेचारी गाड़ी पे हो चुके थे. बट कमिंग बैक ऑन द टॉपिक, इफ आई एम गोइंग लाइक इन टर्म्स ऑफ डॉक्टर्स, राइट, इफ आई एम गोइंग टू AKU, आई नो, आई एम लाइक ठीक है, AKU मस्ट हैव चेक्ड, वो एक AKU पे मेरा ट्रस्ट है. But there have been incidents where big hospitals had a big hospital in Karachi had somebody with an exact degree.
Yeah, I think this highlights a really
therapist,
proper doctor. Acha, therapist.
I want an exact degree.
Bad name in Karachi. In Pakistan, therapists are getting a bad rep.
See, what's important is that the government is working on something. It is a work in progress. It is happening. मगर सारा blame एक body के ऊपर डाल देना कि ये नहीं हुआ है. अगर पता नहीं हुआ है कि जैसे शुरू में तो गाड़ी के licenses नहीं होते थे, मगर हमें पता था कि अगर हम अपनी गाड़ी सड़क पे चला रहे हैं, we don't want to crash into something. So yes, it is like us, the psychologists, the government, whatever. But it's also like if someone's coming in, educate yourself. So in a first session, I actually ask a client, do you have questions for me? Is there anything that you would like to know? Because it's an equal playing field, right? And I encourage doctor shopping. So if someone, अगर किसी को मैं समझ में नहीं आ रही, ठीक है, मैं आपको फिर recommendation दे देती हूँ. आपको किस type की चाहिए या क्या चाहिए, जो भी है.
I mean, to be fair, Sharmeen, it's not like लाइनें लगी हुई हैं therapists की. Usually किसी को time, convenience, करीब, they usually just have one option at best.
Yeah, of course, me.
I think it also shows Sharmeen is a very good therapist, because Sharmeen is obviously very caring of her patients, and you're like, making sure that you're the right person for them. And
let's come back to the subject.
Thinking about all of these things that most people in the public, most lay people just defer to experts. They just assume that this person is an expert, and they are just going to be like, mujhe kya pata? I don't know what therapy is. I don't know what a therapist does. So if this person, they have a nice office, they look like they know what they're doing, they speak like they've gone to university, most people will defer to them. And I think, it's really important to have these kinds of conversations so that people know what they need to do.
I mean, again, right, it's not like people know the difference. के अगर मैं clearly बोलूं, पाकिस्तान में, कराची में, अगर एक therapy works था और एक CCPB, if CCPB is better or associated with somebody, then therapy works. मुझे कैसे पता होगा ये, right? I just see 2 documents कि अच्छा इसकी accreditation यहाँ से, इसकी यहाँ से, दोनों की कहीं ना कहीं कोई affiliation है. How do I know the difference between them? And then how do I know कि अच्छा नहीं, इसने जाकर UK psychology पढ़ी है और इनकी जो degree है वो affiliated, associated degree है. I mean, for somebody walking into therapy without knowing any of it, I don't think, yes, the onus should be on you because it's your mental health at the end of the day. But किसी expert या किसी body को ये चीजें check करने की जरूरत है, वो इंसान तो बेचारा नहीं कर सकता.
And ask, because एक और चीज ये है कि अच्छा आप यहाँ बैठे हैं, सही, अच्छा एक तो होता है ना कि someone says कि England की accredited certification है, अचानक से that person gets wow, बाहर का पड़ा हुआ है, बाहर foreign. And ये foreign के ऊपर इन लोगों ने बहुत exploitation भी की है, because मिसाल के तौर पे लोग जो PhD करके कराची यूनिवर्सिटी से निकल रहे हैं, वो 500,000 रुपए में थेरेपी कर रहे हैं, and ये लोग बहुत qualified हैं, बहुत, जैसे I look up to these people for the amount of years and experience that they have, and they would be charging 500 to 1,000 rupees because who wants to come to them? And then you go to one of these 1% certifications and they're charging 8,000, 10,000 per session because they speak the language. They look like they went, using Amna's word, look like they went to university. And, so it does make a difference. But then asking, okay, what are your limitations? I mean, one very common question that I get, that I'm sure Amna has gotten at some point, is, okay, what's the difference between a psychiatrist and a psychologist? Can you prescribe medication? Okay, you don't prescribe medication, then what do you do? Okay, so when such questions come through, okay, so a psychiatrist is going to diagnose me or whatever. So अगर हम ऐसे सवालों के जवाब दे सकते हैं, then हम और भी, like maybe someone hasn't thought about it. Say, अच्छा मेरी degree है इसके अंदर, इसकी certification है, इसकी licensing है, इसकी ये है, थोड़ा सा समझा दें कि वो भी qualified है, मगर उनकी qualification शायद मेरे से कम है, कि शायद वो सिर्फ आपको परेशानी में मदद कर सकें, हम आपको परेशानी और बीमारी में मदद कर सकते हैं, or however it works for that person in front of you.
Just changing tracks a little, I think जब नूर का केस हुआ था, a lot of the conversation sort of became online about schizophrenia, and I was like, भाई मतलब saying people with schizophrenia murder, because वो हर title news title पे, and people are like, हाँ तो इसमें झूठ क्या है, उसको अगर था तो हम लिख रहे हैं. I was like, that's like saying cyclist murders somebody. The fact that he cycles has nothing to do with the murder. And then एक study भी आई थी कि अगर आप general करें तो people with schizophrenia, people without schizophrenia, murder rates में कोई फर्क नहीं है. How problematic is that for even our news headlines to be like, guy with schizophrenia murders somebody?
I think it's a big problem, and it's not just in Pakistan. This is a problem everywhere. Every time something like this happens, even in this country, immediately the media wants to start investigating. Like मैं पहले कह रही थी, that we immediately want to start analyzing the perpetrator. We want to start analyzing the offender and find out why he's different from us, why he's different from the rest of the society. कि ये हमारी society से अलग है. There is something wrong with him or her, and that, it's not something that would ever happen to me because I'm not like that. And that it's very easy then to use mental illness to say that acha, it's probably because he has a mental illness. It's probably because they have some issue that I don't have. So it's a big problem that is used across the world in the media and in societies to divert attention away from societal issues and, community issues that play into violent offenses, because it's easier to focus on that person and to say that there's something wrong with this person, rather than to admit that there's something wrong with the entire culture and environment around this person that all of us are a part of and all of us have a responsibility for. So I think that's one of the main reasons that this happens, and that's why it's a big problem also for people who have mental illnesses, because of the stigma of people relating violence with mental illness and saying that people with mental illnesses are probably more violent than other people, which is just not true.
Yeah, and it also demonizes everybody with, again, mental health issues. It's like broad term है, but खुद भी तो सब diagnose कर लेते हैं, किसी को लगे हाँ इसको schizophrenia है, ये भी murderer होगा, as if वो तो given है.
And bachpan se, like that one concept of pagal that we've grown up with, when we were studying, when we were in our bachelor's, everyone who does their bachelor's in psychology does not necessarily go into therapy. But because we had certain modules in which we had to have those one-on-one case reports, a lot of people were scared of going and doing that. A lot of students that I studied with, they're like, nahi, hame nahi jana hospital, wahan pagal hote hain. तो एक हमारा social stigma भी है जो वहाँ है. And I think what's most important is अपनी जिम्मेदारी लेना और अपनी socially जिम्मेदारी लेना. I think that everything comes down to that, because it's very easy to blame men or women or doctors or psychologists or God or the world or global warming. But when we start taking responsibility for ourselves and our actions, something small as, okay, fine, I have schizophrenia. Am I taking my medication on time? Because I can have a very fulfilling life. I can have a job. I can have children. I can have everything if I take my medication. Disclaimer. That was an example.
So, like, for instance, in this case, अगर हम फिर से बात करें, generally, I like to think I have empathy. I've talked a lot about mental health thing. In this case, मेरी कोई empathy नहीं थी. I was like, जो mental health issues होंगे, जो भी होंगे, but ये इंसान एक murderer है, right?
Yeah.
Yeah, and that's part of that anger, na? It's that societal anger of.
But is it unfair? Is this? Are you saying this anger is unfair?
No, I think it's totally justified because of what Sharmeen was saying earlier. We're in that phase, in that initial phase of trying to get justice, but not necessarily knowing where to get it from and how to address the issue. And I think the other part of that is that something you were saying earlier, that people don't have faith in the justice system. People don't believe that something is going to get done. People don't believe that there will be any, rehabilitation or any kind of outcome. And that's why they will say that he should be hanged, because they think that this is the only option for justice that is available to us right now. And I think it just reflects the state, the time that the society is in right now, the way that anger is being triggered in everyone, because we all feel hopeless, that as if nothing can be done. This problem is too big. We are now just beginning to address the problem, and it's so big that it's overwhelming, and people are obviously going to start feeling hopeless and going like, well, what else can we do? We just have to get rid of everyone who commits an offense like this.
I think it's also the idea of the elite that they can get away with it. They tried to get away with it. Maybe इस case पे ये बात करना थोड़ा मुश्किल है. There's another case where a principal of a school has been I think the courts have given her a death sentence for blasphemy because she claimed to be a prophet, or उन्होंने pamphlets बांटे. कुछ clearly it seems like, at least from the reporting, कि कुछ है underlying mental health condition जिसकी वजह से she's doing this. In this case, like, my position is clear, right? कि I feel like ये बहुत unjustified है. कि अगर किसी इंसान को एक मेंटल हेल्थ कंडीशन है जिसकी वजह से वो ये कर रही है और आप उसको डेथ सेंटेंस दे दें फॉर दिस, फॉर ब्लास्फेमी, इन दिस इट्स वेरी क्लियर टू मी कि ये बहुत अनफेयर है.
Amna, me?
Either.
So technically we do have a mental health act in place, which is for these things. If you ask my personal opinion, I think the blasphemy law is used more to indict children or people who जिनके होशो हवास शायद पूरे तरह से उनके ना हो, which is not fair. Mental health, again, I think 2014 के बाद is something that has gotten more traction even in terms of laws, and there are things that are working on it. I think 2016 या 17 की बात है जहाँ सुप्रीम कोर्ट के किसी जज ने कहा था कि ये mental health कुछ नहीं होती, and death sentence is death sentence, and उसके ऊपर like to a schizophrenic murderer, and उसके ऊपर एक बहुत बड़ा वो भी हुआ था, काफी civil activists ने काफी काम भी किया था. So it's a work in progress. I do agree with you that it does sound like this lady had certain delusions that may have led her there, even though I don't know much about this case. But I know it's not saying much, but what I can say is that everything you say, I do understand, and it's a work in progress. I can't speak for the government really.
So on the question of the जो आपने example दी schizophrenic murderer, कितना onus हम रख सकते हैं? So like you said, take your medicine, be a functional part of society. If a person is not doing that, I don't know if chooses to do that is too strong a thing to say. In terms of the law, what do you think the onus should be on the person? Because at the end of the day, if you've murdered somebody,
I think it's very important to be able to apply responsibility without applying blame. So if somebody has committed a violent offense, then they should go through the criminal justice system, and they should face whatever the consequences are for that violent offense. And then you take into account all the other factors. So when you're working with that person, you have to take into account all the other factors that have gone into their committing a violent offense. So it's too binary to say that if someone has a mental illness, they should get a lenient sentence, or if someone has a mental illness, they should immediately get convicted. You need to separate these two. That's what I was saying before, that these two things have become too kind of tangled together, and people always are seeing violence and mental illness in the same kind of, as the same thing. But actually, you have to separate these two things. Like you said, if someone has committed a murder, they have committed a murder, and they should then go through the process of anyone else who has committed a murder. And then during that process, you would then take into account what factors led to them committing this murder and how do you counter those factors and make sure that it doesn't happen again. But I think that's what I was saying before, that it's a long process. It takes a lot of people to work very hard to come up with a way to do this. And I think in Pakistan, people are already so disheartened and they don't think that this is possible. And so it's a lot easier to then ask for an immediate resolution.
I think all of these things are true, but is case mein, kyunki they're being brought up, suddenly mental health is important. So I see how people see it as a way of trying to humanize a murderer. Like for instance, OJ case mein, America mein cops racist hain, bilkul hain, systematically racist hain, but OJ was able to exploit that for himself, despite seemingly being a murderer. And Norm Macdonald के अगर आप जोक्स सुने तो आपको 35 मिनट के जोक्स मिलेंगे on how he is a murderer. तो वो OJ ने exploit कर लिया because वो अमीर था, वो he had the resources to do that. So even in this case, if they manage to exploit or use a mental health loophole in the law, I'll be part of the protests if against the courts if that happens.
I don't think we're there yet.
Is there any mental health loophole? That's the other thing that I don't know. Is it available to them? Is there
Yeah, I don't think we're there yet.
Reduce to ho sakta hai. Murder to manslaughter.
There's a mental health act. I don't think it's a mental health law yet. जो भी एक कुछ होता है, difference होती है थोड़ी सी. क्योंकि like I said, वो जो साहब थे judge who said कि schizophrenia is not a this thing, murder is murder. And the second thing is that our constitution is about 200-300 years old. And while amendments are coming into it, while the law is changing, it is taking time. 2014 जब से APS के attacks हुए, तब से वो mental health act हर province का एक is supposed to go through, which you hear about every 6 months or so. They're still working on it. And while they're still working on it, there's certain things like jail ward के cases जो हमारे पास आते थे while we worked in the government. So what I understand from the jail system because of that is कि अगर आपको blood pressure का मसला है, अगर आपको diabetes का मसला है, कोई भी prescription medication का मसला है, the family will go and put it into the pharmacy and the pharmacy will give prisoner X their medication accordingly. अगर आप antipsychotics पे हैं, antidepressants पे हैं या ऐसी किसी भी medication पे हैं, उसकी कोई pharmacy में recognition ही नहीं है. So we used to have people coming to us who may have like committed murder, for example, have been on antipsychotics, have been like diagnosed with schizophrenia 20 years ago. मगर वो पिछले like 4 महीने में क्योंकि उन्हें दवाई नहीं मिली है, उनके सारे symptoms वापस आ रहे हैं. So you know, it's also very important कि सबसे पहले जो आपके existing system है उसको ठीक करें जिससे पहले के नए like वो हो. So I think it's a work in progress. It's going to take some time.
I think that's the thing to remember is that these changes, systemic changes that are needed take a really, really long time. And there is going to be a phase where the public in general are going to be angry, whether they're on one side or the other, both sides are going to be angry because these kinds of changes require that anger in the first place. So it's just going to take a long time.
I mean, I'm sure it factors in, but how much does it factor in terms of social stimuli adding to that? Because even let's say, I may be completely wrong, but अगर schizophrenia, एक तरह का schizophrenia, एक self-defense mechanism भी होता है, where you sort of go inside your head. The fact that you're being attacked so much और आपका self-defense mechanism इतना ज़्यादा trigger हो रहा है, अगर वो ना हो, or if we as a society look at it differently, because once we put a label, okay, this person is mad, this person has schizophrenia, wo phir you're also chemically worsening the condition. Is that a correct hypothesis?
I didn't completely understand, but I think
अगर let's say अगर किसी को है, let's say बचपन में diagnose हो गया, and then everybody around that person is also like, हाँ तुम तो पागल हो, तुम्हें तो schizophrenia.
So for example, if someone has paranoid schizophrenia, you would be making them more paranoid by thinking that they are going to do something violent, or by kind of treating them in a way that makes them feel on edge or anxious. Is that what you're saying? I mean,
Yeah,
I
that
think
makes sense.
it could happen. Obviously, if somebody already has an acute mental illness, if they're suffering from psychosis and they're already having these kinds of stressful thoughts, uske upar se there are external, pressures on them, external stress on them, we know that one of the things that triggers schizophrenia in the first place is trauma. So if you have that external trauma occurring, it is very possible for it to make your psychosis a lot worse, or for it to trigger it in a certain way.
I'd like to reiterate something here. Be the diagnosis schizophrenic, bipolar, depression, anxiety, jo bhi diagnosis ho, it is very important to note that a person can, with the help of medication and therapy, have a very fulfilling holistic life. जहाँ वो नौकरी भी कर सकते हैं, वो relationships भी रख सकते हैं, वो independently रह भी सकते हैं. And it's very important to say this because हमारे पास क्या होता है, एक excuse me, एक role होती है जो हमने अपने खानदान में सेट की होती है for someone जो बीमार है. उस बंदे की एक जिम्मेदारी हो जाती है बीमार का रोल अपहोल्ड करने का, कि for example my uncle or my brother or my sister has schizophrenia because she went through a divorce, or has anxiety, so they cannot work in high stress these things, तो उनको घर पे बिठा दिया जाता है. And वो सारी जिंदगी उनकी service के अंदर ना, there's one person of the family who makes it their job to be in service to them. So that's actually, like you said, it's making the symptoms worse because that person gets used to their symptoms for getting that kind of service. किसको नहीं चाहिए घर पे बैठी हुई रोटी, right? But it becomes a loop jahan the caretaker as well as the person being taken care of gets stuck in this loop of not getting better. So it's very important to be wary of that as well. It's a very common thing.
It's very dehumanizing because, again, I think that's what you were saying before, that it just becomes about the diagnosis. And I think that's a very important point to make, that diagnosis is just a word. It doesn't actually mean anything. Every person's, you can have 10 people with a diagnosis of schizophrenia, and every single one of them is going to be completely different and have completely different symptoms and have, a totally different psychological issues and totally different personalities. And I think that that's the danger with diagnosis of mental illness, कि एक दफा किसी को diagnosis मिल जाती है, people have this image of what that diagnosis looks like. And I think when you say schizophrenia, people imagine like this really, psychotic, crazy, like extreme, I don't know, presentation of schizophrenia, that they're hearing voices and they're completely psychotic and they're going around trying to kill people. And it's like, that's not the case. And I think it's really important to remember that a person is not a diagnosis. A diagnosis is really just there for, medical purposes. It's not even really for us as psychologists, because we still need to do a full formulation. We need to find out all the factors. We need to figure out what the personality is like. So even for us, a diagnosis doesn't really tell us anything about a person.
That's a very good line. You are not your diagnosis. I think the first time, second time I went to Sharmeen, I was like, ये bipolar diagnosis, like side पे रखो इसको, ये वापस envelope में रखो. I was like, अच्छा ठीक है, रख देता हूँ इसको side पे.
क्योंकि हम बहुत label centric हो जाते हैं ना. अब जैसे आजकल अगेन मैं सोशल बातों में जा रही हूँ, आजकल की दुनिया के अंदर हमें इतनी नॉन बाइनरी लेबल्स की एक एक्सेसिबिलिटी मिल गई ना, लाइक इट्स अ बुफे, but all of us still need a label, even if it is non-binary, to labelize us for that identification. So when someone makes a psychological diagnosis a part of their identity, it can actually be counterproductive to getting past it. So certain labels को side पे रखना बेहतर होता है.
Yeah, I think maybe people can see it a lot more clearly. We also did a podcast on disability, and जिन लोगों को loves problematic लगता है, I think rhetoric से थोड़ा बाहर है, because if you talk to people from the community, they don't really care about the loves. They care about how you treat them. It's that same thing, right? अगर किसी को आप कहें हाँ ये तो लंगड़ा है, ये तो कुछ भी नहीं कर सकता, ये तो लंगड़ा है, फिर आप उसको you are that person may not be bedridden. You're making that person bedridden. You're creating a society where that person can't function.
Yeah.
With these cases, Sharmeen, I'm sure you've thought about this, because I think they've made everybody reflect. As a therapist, as somebody who has so much empathy, who cares about the client, I'm sure you've thought about कि कब अब red button दबाने की जरूरत होती है. Like, at what point does it have to come where you're like, no, this person may go out and cause harm? Because I do feel कि, yeah, I think कुछ एक obligation होती है, if I'm not mistaken, आप लोग मुझे बताएं कि if a psychologist or therapist knows for a fact that this person will commit violence and that the person goes out and commits violence, the psychologist and therapist can also be deemed guilty, right?
I would say yes. In this country, you have to have, so firstly, you have to record everything that you do. You have to make sure that everything that you do with any person is recorded so that somebody else can read it and somebody else can see what decisions you made for that person and whether or not, if they need to be reviewed. And the second part is that if that risk always trumps confidentiality. So if you feel that somebody is going to pose a risk to themselves or to anyone else, then you are allowed to break confidentiality. You can then, do whatever you need to do, report them to the police, contact the person who you think is at risk, do what you need to do, because risk always trumps confidentiality. So you won't, agar koi aapko aake bata raha hai that I'm planning on, killing this person, you're not just going to sit there and write it in your notebook and send them home, I hope.
You also have to ask them how, so that you can help them make a better plan. Okay, no, I'm sorry. She's right. She's right. And this is something we also
if they need any help.
हाँ तो body के साथ क्या करना? I'm sorry. This is wrong. We should not even be saying this as a joke. I apologize. No, but like Amna said, like this is something we also addressed in the first session, that if we feel that you are a danger to yourself or to someone else, we will get someone else involved. And we normally have a conversation about that first. And if अच्छा ये stage आ गई है, I will be telling someone, ताकि बाद में भी वो बंदा नहीं जाकर बोले ओ मैं तो बस मजाक कर रहा था, और आपने मेरी confidentiality को वो किया, तो at that point अच्छा this is what's happening today. ठीक है, at least that's how I take it.
Yeah.
I mean, खैर मेरे फलसफे सुसाइड के बारे में different है. Danger to yourself, I do feel you have a right to your own body. अगर आपने abuse करनी है, अगर आपने I mean, वो commit suicide का भी जो idea है ना कि बड़ा कोई crime कर दिया आपने, it's really problematic. But like again, how do you draw that distinction, right? So like for instance, if we've talked about suicide ideation, what makes you think like हाँ ये करेगा तो नहीं है, ये बकवास कर ये actually danger to himself नहीं है.
You really go deep into that conversation. So for example, suicidal ideation and suicidal like actually being suicidal के अंदर फर्क है. Suicidal ideation अक्सर is just someone who's trying to say I'm not okay, I need help. And then there's self-harm, which is somewhere between suicide and suicidal ideation. So having a conversation about it, seeing what can be done, saying okay, how serious is it? At some point, you might need to refer them to a psychiatrist or immediate medical attention. Then वो हमारे स्कोप से बाहर चली जाती है, because then वो serious case हो जाता है. अगर self harm भी इस level का है कि वो नहीं हो रहा तो ठीक है, सही है, you need to see a doctor. So yeah, those things are important. And I guess हाँ आपका जिस्म है. And for that one thing, I think पिछले हफ्ते ही हुआ है, the Pakistani government decriminalized suicide. So something that I was saying, suicide is a crime that is punishable by death. It's not anymore. So which is I think a good thing, because people will actually get that space to get the treatment that they require when such things happen, instead of
what a nice government. They're like, if you failed, we'll help you. We'll help
yeah,
you.
exactly. It makes no sense. But I think also on that point, people have a right to their own body. But I think that if you have come to therapy, then you are kind of holding your own therapist responsible as well to keep you safe because you feel that you're not being able to keep yourself safe. So I think in my experience, most people who are actually serious about committing suicide would not go to therapy and would not tell someone about it, because I think most people, like Sharmeen said, it is actually a cry for help, or most people who are saying that I don't feel safe, like I feel like I'm going to hurt myself, and that's scary, as opposed to, you know, I really want to hurt myself. So and I think the second part of that was, yeah, you have to do full risk assessment. You have to sit and talk to that person. You have to go into that conversation. You have to look at the risk factors, how likely, you know, they are to actually do something. Will include looking at how likely are they to be in that situation where they would be able to do it. You know, are there any other people who have they've told about it? Like, there's all these other risk factors that you would then assess to determine whether or not you need to take some kind of extra action for that person.
What are those risk factors, right? Because somebody comes and talks about, let's say, has dreams about committing violence against women and says कि मैं कभी करूँगा नहीं, बस मुझे ये आते हैं, मेरी fantasies हैं, but that person says I won't ever do it. It's possible, right? It's not that ridiculous to think of that possibility.
There are a lot of risk factors for violence against women. So one of the most prevalent risk factors for committing violence is previous behavior. So the first thing that you would look at is their previous behavior and whether they have ever committed violence in the past, because that's a very big predictor of future behavior. And then you would look at things like their interpersonal relationships with their family and friends. Have they had any conflicts within their relationships? Have they had any other issues? You would look at their work history, school history, employment history. You know, have they had any kind of reports against them? Has there been any other incidents? You would look at their education level. That's another thing that is a known risk factor for committing violence. Socioeconomic status, like there's so many factors that I could name: drug abuse, alcohol abuse, you know. And then you would also look at you don't just look at risk factors, you also then look at protective factors. So you look at protective factors that would, you know, stop them from committing a violent offense. So they might have lots of risk factors, but then they might also have a protective factor, like a very loving, supportive family that they don't want to, you know, lose, or they might have career ambitions, or they might have, you know, other things that are going to work against those risk factors. So you have to do a full assessment to then decide how risky a person actually is.
Sharmeen, is it any different in Pakistan where that file might not exist? तो अगर वो 10 साल से भी अपनी बीवी को मार रहा है, उसका कोई रिकॉर्ड नहीं होगा.
नहीं होगा. मगर अगर कोई आपके पास आ रहा है, वो उस openness के साथ आएंगे that they would want to speak about themselves, especially abuse. If he's already in a place of being an abuser, right? Abusers want to be heard, be it from a place of remorse or from a place of boasting. They would be open to having that conversation. And when you start speaking about it, just Amna ne kaha, there are all of those risk factors. Then there's also the fact of normally abusers were abused as children. So could be that person was sexually abused. Maybe that person was physically abused. Maybe their mother like literally beat the shit out of them, which is why they grew up to have that insane resentment towards women. Or maybe they saw their father abusing their mother and they just thought it was normal behavior. Ke yehi pyar hota hai. You know, it is love to beat up my wife, and I'm showing her and my kids love by beating them up. So those can also be things. So it's more or less the same.
तो ये जो जिस इंसान को लगता है कि बीवी को बच्चों को मारना ही तो प्यार है, does that person not want love? That person should also be like, आप भी मुझे मारें सब लोग. अगर इसको वाकई लगता है प्यार है, तो he should also be loved.
Most of the time,
in the street and be like, people, please love me.
I think most of the time you will find that you're like, I work in prisons and in high secure forensic units, and the patients that I work with, they are victims and perpetrators. You will find that they are usually both. They abuse people, they also get abused themselves. And I think that that's one of the main things, that if somebody does think that this is what love is, that isi tarah hota hai, you know, sabke ghar mein aisa hota hai, they are much more willing to accept that abuse themselves as well. So they do tend to themselves also be in very abusive situations. And like Sharmeen was saying before, it's like a cycle. It just perpetuates and it goes on and on, because you're constantly just encouraging that same behavior in the next generations, and it keeps kind of being passed down.
When we talk about mental health and mental health issues, do you also feel like a narrative जो है वो बहुत ही skewed है या बहुत ही problematic है? Because things like violence, right? You'll also be like, oh, this person committed a murder and mental health issues होंगे, which may not mean a diagnosed mental health issue. Like if you're really, really misogynistic, yeah, there's something wrong with you, but it's not a mental health issue. So you get the confusion of the narrative. And what can be done to change it?
That's what we were saying before, that there's this perception that you need to have a diagnosis of a mental illness in order to kind of receive therapy, or that you know, a mental health issue. There's a difference between having mental health problems and having a mental illness. And I think that everybody has mental health problems, because it's just a normal thing. Like every time you get stressed, every time you get anxious about something, every time you get afraid of something, you know, every time you're not being able to sleep at night, all of these are low level mental health issues. And you need to, and that's why I think Sharmeen was saying everyone should do therapy, because everyone has little things in their lives that are not ideal. Everyone has habits that are not ideal. Everyone has, you know, experiences that are not the most positive. And it's not necessarily, you don't necessarily, you know, have a mental illness if you get insomnia for a few months, or if, you know, you've gone through trauma and it's affecting the way that your appetite, or it's affecting the way that you do your work. These are all mental health issues that can be resolved through therapy, and it doesn't have to be a mental illness. And I think that that's why people assume that every mental health issue is a mental illness, and that mental illness is then connected with violent behavior. And that's not, yeah, I think that's where we have to start to try to break those connections between those two things, and saying that everybody has mental health. It's like physical health. You have to maintain your physical health, and you have to maintain your mental health. It doesn't mean, you know, going to the gym to maintain your physical health doesn't mean that you have a physical illness. It's just something that you do.
Or you can
and
be crazy
taking time
and
out
be
for
happy
that.
being crazy. Ji Sharmeen.
Pardon?
Or you can be crazy and be happy being crazy.
Yeah,
Embrace
that
the
works
craze.
So taking out time for your mental health is very important, because aajkal, again, internet and like the pace of life has become so fast that we don't, what was taken for granted 30 years ago doesn't happen anymore. So make that time for yourself is very important. But like Shahzad, like you said a little while earlier, कि, you know, सारी औरतें बुरी drivers होती हैं, or, you know, this little mental notes we made. I mean, you didn't say it in that way. You were like talking about a
Sharmeen, do you
thought
not
process.
realize
Let's
who I
see, right?
am? Somebody will take the second out. Okay, Shahzad, you
That
said,
is true.
and
I
this will go
apologize.
viral on
To
Twitter.
clarify,
Yes.
it was a thought example that you gave, not your own example. So the same way that, you know, like saying that we have certain preconceived notions that we grew up with, you know, a woman's place is in the kitchen. I am not saying it is. Wow, so many clarifications he said. The point being that there's a lot of thought processes we grew up with, like लड़के रोते नहीं है, ठीक है, मर्द को दर्द नहीं होता, मूंछ नहीं तो कुछ नहीं, or whatever रिक्शों के पीछे लिखा होता है. And those things also add up to that, like, view of life. And like you said, we're unlearning certain things every day, because what might be true on a genetic level or historically for us may not be true for us aajkal ke zamane mein. So yeah, our executive thought functionings come in, and we unlearn and relearn a lot of new things every day. And that's also mental health.
Deep cut, Amna, I'm not sure if you remember, but only bad driving they do is driving me crazy. I don't know. ये मेरी लाइन नहीं है, किसी और की लाइन है. If you don't remember, I'll tell you बाद में. Since हम ये cancel culture उस पे आ गए हैं, should we just end this by discussing the psychology of cancel culture and online hate? And I've been thinking about that, and मेरे बहुत ही एक unhealthy relationship है भी social media के साथ. But it's true, right? Everybody who's out there abusing people online, there's something seriously wrong in their own lives for them to take out time go online and be like आतिफ असलम कुत्ता है, मतलब कुछ तो आपकी जिंदगी में बुरा हो रहा है ना, जिसकी वजह से आप जाकर ये कर रहे हैं.
I mean, I don't fully understand because I stay away from social media. I just like reading sometimes Shehzad ke page pe I like reading the comment sections. See, I like seeing the
Sadomasochist. That's your sadomasochist fantasy.
I have a question.
Like my entertainment. Yeah, Sharmeen.
Dr. Amna, I have a question. I mean, there's a lot that I'm learning, right? Every day in therapy, I learn new concepts as well. But ये cancel culture का point क्या है?
That's what I'm asking. Like, I don't fully understand what cancel culture. So somebody does something that people don't like online, and then what happens? They get.
I mean, let's say I cancel you.
What does it mean to be cancelled? What does it mean to be
फायदा क्या होगा? Yeah.
हाँ.
Shehzad, like फायदा क्या है? Like आपकी जिंदगी में मेरी जिंदगी में.
Multiple फायदे हैं ना. देखें, एक जो what was the idea about neutralizing violence, moralizing it?
Moral neutralization of violence.
अलग अलग मैंने सारे लफ्ज सही पहचान लिए थे, मैं जोड़ नहीं सका उनको. Much like vulnerable, I had a hard time. It's the same. It's that same idea, right? कि I want to be. I look at Shehzad. He's doing a podcast. He's doing comedy. He's doing well in life. मुझे दिल से तो बुरा लग रहा है कि यार ये कुत्ते का बच्चा ये कर कैसे रहा है. मैं अपने 9 to 5 जॉब जाता हूँ, बहुत से गालियां गाता हूँ. This person does this. This person doesn't even look talented. Person even has this ugly face. Why the fuck is this person successful? इसको लोग सुनते क्यों हैं? अब मेरे अंदर तो मुझे नफरत आ रही है, राइट? इसको देखकर, इसकी शक्ल देख के मेरा दिल जा रहा है. अब मैं आईने में देखूं और सोचूं कि यार why do I hate this person? Does this person's existence make me feel inadequate? Or I can be like, no, my hate is justified because this person said this thing that's problematic. Now the violence, or at least the online abuse I will commit against this person is justified. Cancel culture जो लोग engage करते हैं, they see themselves as heroes. They see themselves as revolutionaries. Literally, there are some of these cancel culture warriors. वो अपने ऐसे लिखते हैं कि हम लोगों ने ये एक नई wave launch कर दी है कि हम लोग तो अब ये भी बुरे हैं, ये भी बुरे हैं, ये भी बुरे हैं. हम जो कर रहे हैं ना, this now is revolutionary, whereas all they're doing is projecting hate. All they're doing is the hate that they feel themselves, and they hate somebody else who has something that they want. बेचारे हैं. At the end of the day, I'm honestly, if you maybe go to some of these troll accounts या उनके घर में जाके आप मिलें, I'll be like, जा बेटा, तू और गालियां दे. तुझे जरूरत है इस चीज की, because I mean look at the lives people live in Pakistan, right? अगर इतने mental health मसले हैं, इतना abuse है, इतने socio-economic मसले हैं, it makes sense that they go online and abuse people.
I think that this is the same thing that we were talking about before, but it's just, it looks different because social media, you know, is a new thing relatively, and modern society looks different, but the problems are the same. So when we were talking earlier about mob mentality and mob culture, it's the same thing that's happening, but social media has empowered people because it gives you that anonymity, that what Sharmeen was talking about before, that diffusion of responsibility. कि आपके सामने अगर कोई खड़ा हुआ होता, then you, even if you had all these feelings about them, you would not say it to them. Like, I'm sure, Shehzad, there were many people who didn't like you in school. They didn't come and say it to your face. But
no, now, they tried. I ran away to Jibi's car.
But now they have that open platform to announce their feelings without any kind of consequence, without any kind of feedback, without any kind of repercussion. And I think that's what's happening. It's the same problem, which has just evolved because of the internet and because of social media. And I think that it comes back to the same issue of societal, you know, acceptance of certain forms of violence.
Yeah, the in-group, out-group thing, that if everyone is canceling Shehzad, we have to cancel Shehzad, otherwise we will be cancelled.
Yeah.
So we are cool if we cancel Shehzad, like, you know. But what about Lovism? Like, what about the fact that people will be... Lovism. I mean, you know, people... People are all over. Sorry, Shahzad, like we have decided to spread lovism in this world for the last
ये
decade.
मैंने भी
now.
कोशिश की थी और मैं फेल हो गया और मैं
और
जितना
हाँ।
जलील हुआ, part of the reason कि मैं हर जगह जलील भी होता हूँ because a lot of times these mob went after people. I was like नहीं यार ये गलत है. I mean like if you're just gang, they were like अच्छा तू तो इधर आना पहले.
it's like us and them. You're
Yeah.
either with us or you're with them, and this is the
Yeah.
mentality which mostly leads to these kinds of violent incidents. This mentality, this binary mentality of I'm either good or I'm bad. I'm either on this side or I'm on that side, without the ability to reflect on the reasons why something is happening and the reasons why you are making this decision, as opposed to
I
just
like to,
yeah. Go on.
yeah, another tangent that I think is really important is कि हमारी society के अंदर जब लड़ाइयाँ होती हैं, जब बच्चे को कुट पड़ रही होती है, जब होमवर्क के लिए उसको चप्पल उसके सर पे फेंका जाता है, ये सारी चीजें सबके सामने होती हैं. मगर जब प्यार की बारी आती है ना, except for like हाय मेरा बच्चा 10 out of 10 आ गए, you know, प्यार घर में नजर नहीं आता, क्योंकि माँ बाप भी जब प्यार कर रहे होते हैं वो बंद दरवाजे के पीछे कर रहे होते हैं, मगर जब लड़ रहे होते हैं ना तो सास ससुर नंद भाभी सबके सामने लड़ रहे होते हैं. तो उसकी वजह से भी we have a very skewed relationship with love itself. So अगर चीखना चिल्लाना क्या बोलते हैं extended families में, joint families में हम देख रहे होते हैं, that is love to us. That's why on a larger media like social media we will go and spread that love by canceling people. I mean क्या होता है हमारी joint families में भी तो यही होता है ना, 10 साल हमने फुप्पो से बात नहीं की, then फुप्पो से दोस्ती हो गई तो फिर 10 साल हमने चाचा से बात नहीं की या मामू से बात नहीं की, ऐसे ही चलता रहता है, ये तो love है. So also reconstructing that and coming out with it's okay to compliment someone openly. There's no shame in that. Compliments are shameful. Saying nice things are shameful. I'm just very lovism today.
I totally agree, and I think that that's one of the main things that it's a really important conversation to have, that people don't know how to express positive feelings towards each other. People don't know how to express positive emotions towards each other, and it's this notion कि गुस्से में प्यार होता है. You know, they will cheat him because they love you, because they care about you, that's why they're hitting you. It's like that's not, it's just, it's a more abusive sort of,
it's very toxic.
Yeah, it's a really toxic perception of making people accept those behaviors by telling them that it's a positive behavior, by telling them that it's love, when actually you know, instinctively you know that this is not right, but
and the most subtle
loves...
form of abuse, the most subtle form of abuse that we go through is कि अगर someone is nice to us, हम उस एक fear में बैठ जाते हैं कि एक indebtedness आ जाती है कि they're being so nice to us, what do I have to do in exchange? क्योंकि हमें घर पे ये भी सिखाया जाता है कि चलो we will be nice to you if you get all A's, or if you know, those kind of things. So that's also a very toxic transactional approach. I'm sorry Shaz, I cut you off.
I just saw a meme today and said basically friend zone का मतलब होता है कि the guy is saying I'm so nice, why are you not taking my penis?
Transactionality.
Yeah. Exactly.
And yeah, nobody loves each other more than UFC fighters. अगर गुस्से का नाम ही प्यार होता है, सारा moment ही गुजर गया. But basically मैं कहना चाहता था कि Freud will be very happy with Sharmeen to know that Sharmeen thinks parents should make love in front of their children. I think that...
Yep, that is what Sharmeen just said. मुझे भी किसी indecency उसमें ना अंदर करवा दे.
यहाँ तो
मैं cancel.
Air Blue में एक पप्पी हो जाए तो वो एक national crisis हो जाता है. यहाँ कौन किसके सामने प्यार करेगा? I agree with all of the things you guys are saying, and I think in principle they're right. But मैं ये सब करके जलील हो चुका हूँ. So I also want to tell people कि I think decide कहाँ आपने क्या करना है. अगर आपकी नहीं है capacity, you open up, especially if you have a public, well everybody has a public profile now. सबके Instagram पे कुछ 100 लोग तो हैं ही हैं ना. And you're putting yourself out there, see what capacity you have. And dunya bhi hai kamini, so if you are really kind and nice to everybody, people also fuck you over.
I think the most important thing is to always be thinking. Don't do anything without thinking about it. Have control over yourself and what you do, because you cannot control what other people do. You cannot control what other people say, but you have control over what you do, and you have control over your own mind. So don't just throw yourself into social media arguments because you're feeling angry. Isne mujhe ye bih keh diya, or that person disagreed with me or whatever. Just, think about what is the benefit to you and what you're getting out of this situation before you put yourself into a stressful and tiring situation that you're not going to get anything out of.
And block, delete people, even if they're friends and they're bad for you. Instagram has this great feature: block this person and any account they ever create.
Wow.
मैं तो हमेशा वही करता हूँ कि अगर कल को कोई और भी बनाए ना, वो भी ब्लॉक हो अकाउंट.
ये ब्लॉक डिलीट भी मुझे खास समझ में नहीं आता, मगर शायद मेरा जमाना अलग है.
आप आए ना कभी, आप यहाँ आए ना खुशबू लगा के, जब आपकी सर कटी हुई तस्वीरें लोग आपको डीएम करें ना, उसके बाद ब्लॉक डिलीट ही करना चाहिए आप.
Oh shit.
Too much. People get extra, but that's what I was saying. It's so easy to be extreme on social media because nobody knows who you are or what you're like. Nobody can give you any feedback.
Oh, by the way, Shahzad, all of those threats you receive, you can now just report them to the PTA.
Really?
Yeah, PTA has become very active with that. वो block delete करेंगे ना?
खैर, I can also use FIA against certain people, but I feel like these institutions have been used by the people in power against victims for so long that I'm not going to use them.
I think it comes full circle to where we started our discussion. Like we expect the law to be doing certain things and acting as a deterrent, yet we don't use the law the way it's meant to be used. So maybe if you actually use the law for FIA or PTA or whatever things that it's meant for, then maybe the law would actually do what it's meant to do. And like we come cycle mein aa gaye.
I agree. It's that perception that we just don't have any faith in the system, and so we don't use the system, and so then the system doesn't get reviewed,
used,
or replayed. Yeah, exactly. Like it's just gonna stay the same. So yeah.
It's also, I mean, like practically, it's also bad PR, right? So मतलब एक दो इंसान हैं जो मुझे constantly harass कर रहे हैं, right? Like मेरे पास सारा उनका, मैंने evidence भी, tweets भी, सब कुछ है मेरे पास. But then I was like, if I go to FIA, they will use that and weaponize this. देखें, Shahzad is trying to silence us and हम victims हैं. I was like, man.
सीधा FIR कटेगी. That becomes a criminal case. If they are actually giving you real threats, it's not just क्या बोलते हैं कि they're being mean to you. It becomes criminal. So when it becomes criminal, FIR करते हैं. And I'm saying this in public so that people who are harassing others know about this.
It's part of it. Oh, no, I shouldn't be this kind. I'd be like, हाँ, आए तो मैं बताता हूँ आपको, जानते नहीं हैं आप लोग मैं कौन. I think people only recognize your kindness when they think you're capable of violence. If you're just being kind and they see you as docile, तो वो फिर they're like, हाँ ये choice थोड़ी है इसकी kindness की, तो मजबूरी है. फिर वो आपको और जलील करते हैं. तो आपको थोड़ा कमीना होना पड़ता है ताकि people are like, oh अच्छा he's choosing to be kind. Wow, thank you so much.
So यही तो, that's what Sharmeen was saying earlier about Lovism. We don't know how to express positive feelings and we don't know how to be positive. So we have to use those negative traits to be like, no, I really mean it when I'm saying something positive because I'm backing it up with all of my negative traits, when you should just be able to say something nice and take it at face value.
I think one of the biggest lessons Shahzad taught me was that it's okay to go out in public and say, hey, hi stranger, I love you. Because
bad idea, guys.
It doesn't have to be
bad
creepy.
idea. Bad idea, guys, don't do it. Jim Morrison taught me that, but chal.
And he's dead now. Okay.
See
you see what happens?
See
what happens when you love?
See what happens when you open doors? See what I've done.
This is the end, my only friend.
So I think
the end is
you also
very
worked
appropriate.
You also worked on me taking a compliment. When I had a hard time taking compliments. I think she's just like, I'm out.
I think she's frozen.
Before these jokes get even worse.
Sharmeen,
I think in one of our like
Yeah, I'm back.
later on, a few months down the line, she said something like nice, and I was like, thanks. And she's like, it's the first time you've said thanks. I was like, really? She's like, usually you say, honey, it's the shirt or it's the weather. Or it's इस तरह का मैं इंसान
Yeah.
हूँ. Like, you look nice. नहीं, it's the weather. It's वो ठंड का मौसम है
It's
ना,
like,
तो उसमें
you know,
it's fall, so your
Harshal, that
standards
and
have
compliments,
fallen.
that was interesting.
So, like,
No, but I'm glad, like, oh, let's not talk about therapy here. I don't know, like I get really uncomfortable when you want to talk. What is your therapy? You can talk about it, I guess.
Boundaries. We've
Huh.
already said on public, on record, what a difficult client I was. फिर मैं sad ही हो गया था ये सुनकर. I think she's frozen again. शर्मीन का इंटरनेट जवाब दे चुका है और संडे की शाम हो रही है. हम सब ने चाय पे जाना है. फॉल की वेदर एंजॉय करनी है. आमना के पास स्वेटर वेदर आ चुका है. हम भी कोशिश करते हैं स्वेटर वेदर ताकि हमारे पेट छुप सकें, वरना तो बहुत मुश्किलात आ चुकी हैं पेंडेमिक की वजह से. Have either of you seen Squid Game?
Not yet, maybe today.
Please watch, then we will analyze the psychology of Squid Game. Thank you everybody for listening. Thank you, Amna. Thank you, Sharmeen, for joining us.
Thank you guys for having me. I hope that I said some smart things.
Bye, Amna. You're so pretty.
One last question. Do you guys think I'm too cute to be this sad?
I think
I'll let yes. This should be
only sometimes.
Bye everybody. Take care.
Okay, bye.